Sometimes people go in for a handshake and then pull you in for a kiss on the cheek. As some U.S. states begin to ease their lockdown restrictions, the future of handshakes and greeting our friends via touch remains uncertain. And with people returning back to work and businesses opening back up, you might be curious to know just how easily coronavirus can spread from person to person based on the type of greeting and personal interaction they use. Should you be shaking hands, fist bumping, elbow touching to greet one another? And what about a hug? Is it banned for good? I'll explain. The urge to reach out physically is deeply wired into us as human beings. Did you know shaking hands is the most common form of social touch in the United States? The handshake is thought to have originated centuries ago as a form of assurance that neither party was carrying a weapon. It signals trust, cooperation, and respect. Nowadays, coming out of this quarantine, we're guaranteed to be faced with a lot of awkwardness as people try to figure out just how to greet one another. Awkward thoughts like, will I get the coronavirus by shaking this person's hand? What about a fist bump? How many germs do hands carry exactly? Is an elbow bump better? Should I just avoid hugging altogether? And don't even get me started on the cheek kiss. Hey everyone, I'm Dr. Wagner. I'm a board-certified emergency medicine physician, and on my show, I answer your urgent medical questions and clear up myths about certain ailments and deadly diseases. Handshakes are just one of the few forms of touch that have evaporated during this global pandemic. Heck, add hugs, high fives, fist bumps, backpacks, and all the little points of contact that we make when we stand closer than 6 feet apart. How much of a petri dish are our hands? Older studies have found that healthcare workers carry up to 5 million bacteria on each hand. Wow. But that's why we're really vigilant about washing our hands before and after every patient encounter. Even door handles and bathroom sink faucets are believed to contain up to 229,000 germs per square inch, and the toilet handle alone contains 38 bacteria per square inch. Should we stop shaking hands? As of right now, perhaps. This is not the time to start coming up with a new handshake between friends. Social distancing does work, so let it work. We need to continue practicing social distance so that we can gradually ease restrictions down the line. If we start gathering at a time when the curve might be starting to bend, we will only see the numbers go back up. What about if I wash my hands after I shake someone's hand? Good question. Many of us don't generally practice good, proper hygiene. Shocking, I know. But Dr. Wagner, I wash my hands with soap and water for 20 seconds. But do you wash the end of your arms as well? Individuals typically don't. Improper hand washing results in a germ playground at the end of our arms that can still cause germs to be transferred to another person. The CDC estimates that 80% of all infections are transferred by hand. That's an incredibly high statistic. Washing your hands directly after handshaking with someone is one way to go about things. But here's a thought. What if you can eliminate handshaking altogether? And do we really want that? So what's a good way to show professionalism in your meetings, or another safe way to greet people you come into contact with? A fist bump, a high five, the elbow bump? Biochemist David Whitworth studied handshakes in his lab in 2014 and found that high-fiving cuts bacteria transmission in half, and fist bumping is even better. 10 times more bacteria get exchanged in a handshake than in a fist bump. Elbow bumps just don't quite cut the mustard when it comes to human connectivity. We typically tend to sneeze or cough into our elbows. Therefore, I would recommend keeping the elbow bumping to a limit. If you think elbow bumps and handshakes are bad, doorknobs may just take the cake on it. Viruses can spread 40 to 60% of an entire building from a single doorknob in mere hours. So to recap, highest transfer bacteria, handshakes. Lowest transfer bacteria, fist bumps. High five is in the middle. Fist bump, less than 10% of the bacteria gets transmitted compared to a handshake. Explanation, handshakes have a greater surface area to contact for a longer period of time. What about hugging? Just don't do it for now. If you want to limit the risk of the number of germs spread, it's advised that each person engaging in a hug turns their head the other way to avoid the other person's face as much as possible. What about kissing? Every kiss begins with 8 million germs. Research suggests that just 10 seconds of lip locking can transmit 80 million germs. Kissing can transmit many germs, including those that cause cold sores and tooth decay. Saliva can transmit various diseases, which means that kissing is a small but significant health risk in general. Coronavirus is a respiratory virus, which means it spreads through respiratory droplets, transmitting through nose, mouth, and eyes. Think about this. Sometimes people go in for a handshake and then pull you in for a kiss on the cheek. What do you do, especially if you don't want to kiss? You can use the handshake as a barrier to stop someone when they want to pull you in for a kiss. So your hand is in between your body and their body. You can just push it out a little bit further away from you, and that way it'll be kind of stopping them. And then gently place your opposite hand on their shoulder, so it feels as though they're getting some physical contact with you, but you're really stopping them from coming any closer. Is there an alternative to greeting people then? Of course there is. There are already a lot of non-contact options. Individuals have been practicing contactless greetings way before COVID-19 barged in. Bowing, for example, is an alternative very widely practiced around the world and has been accredited for fewer deaths due to coronavirus in Thailand. Then there is waving, nodding, smiling, and other nonverbal hand signals that don't involve physical contact. Maybe give your neighbor a little hat tip the next time you see them, 6 feet away, of course. If you feel that personal connections are harder to form when talking to somebody 6 feet away or through a webcam, you're not alone. But at the moment, it is what we have. We are humans, and we know through lots of previous research that we respond well to touch in all forms. I don't think we should get rid of contact with each other altogether. We just have to be aware and make sure we are washing our hands much better than we did before and continue to wear those masks. All right, that's been your 5 minutes of greetings in the age of coronavirus with me, Dr. Wagner. As a friendly reminder, keep your social distance, practice good hygiene by washing your hands, and avoid crowded places if you can. According to Centers for Disease Control and Prevention, hand washing can reduce the number of people who get sick with diarrhea and respiratory illnesses up to 50%. Sound off below in the comments with any medical questions that you might have for me. As always, make sure you subscribe and hit that bell notification. Thank you so much for watching. Stay healthy, my friends.